Essentially, I had a broken jaw twice as a child. Once when I was 3, again when I was 11, and that was due to domestic violence. By the time I was 18, my lower jaw had adhered to the upper jaw, and I could only get my little finger in my mouth to eat. So I started going around looking at different treatment options. Once I exhausted everything that was available to me here in Australia, I went to America. And I had several treatments in America, everything from chiropractic to orthodontic to different types of treatments. Eventually, I found out that my temporal mandibular joint had shattered and my condyle had adhered to the glenoid fossa, and that it required surgery. And at that time, the surgeon suggested replacing my joint with a state-of-the-art implant. He actually said it was so good he wanted to do both sides, but I refused and only allowed him to do one. Unbeknown to me, this joint had actually gone through a lot of testing and was banned in the United Kingdom and Australia, and the joint was faulty. So I had the joint put in, and then my immune system started behaving strangely. And after 9 years of absolute hell, I was now back in Australia, and I was going to doctor to find out what was wrong with me. And because it was a full body experience, I didn't know that I didn't put it together with my joint. And then I found out that what had happened was that I had a joint called Vitec, and that has caused an autoimmune response, a giant cell reaction that dissolved bone and muscle tissue. So how it felt like was, it felt like acid boiling under my skin because it had dissolved into my bloodstream. I tried to contact the original surgeon. He didn't respond to my faxes or phone calls. And eventually I got a letter from him about 8 months after I tried contacting him to say it was a Vitec implant, it was state of the art. There were people who complained, but there really wasn't anything wrong with it. But would I sign a disclaimer? And he would send me $1,000 American. By this time I'd gone in and had surgery to remove that joint. But it was difficult because the surgeon who removed it said it was like scooping out cream cheese. My sinus cavity, my cheekbone, my condyle, and the bone between my brain and my jaw, the glenoid fossa, had dissolved. And it was now in my bloodstream. So I had a temporalis muscle graft, and I didn't have a joint replacement. I live with an autoimmune condition similar to that of lupus. Most of the people who have had Vitec, there were 26,000 implants. Of those 26,000, I believe about approximately 1,000 of us are still surviving, and only a handful of us are actually living normal lives. Most of them have died with all sorts of complications, including autoimmune conditions like cancer. Every few months I explore whether we should go in for more surgery, and because it's like opening a can of worms, we haven't. I've had a partial facial reconstruction where I had my mental nerve cut, which complicates things even more. And thanks to Dr. Sarkis, I've been able to align my occlusion, because that's all I've got, I don't have any joints, to align my occlusion so that I have some stability. Without my occlusion aligned, I am in bed with a migraine, I have vertigo, I'm in severe pain. It's a downward spiral, but with the right occlusion, I can actually hold my head higher, my posture changes, and I can live a normal life.